Clock strikes midnight. This country will have wrapped up its 17th day of the government shutdown.
Washington, D.C. appears to be in an endless deadlock when it comes to reaching any sort of agreement to get the government open. And it looks like it will continue into next week.
Over the past 2 days, Stuart Moore and I interviewed 2 local congressmen about the shutdown and what they're doing to end it. Here is what Representatives Maxwell Frost and Randy Fine had to say.
Both Congressmen Randy Fine and Maxwell Frost joining WESH 2 to talk about the government shutdown more than 2 weeks after it started.
With nearly 9,000 federal workers in Congressman Frost's district not getting paid and nearly 6,000 not getting paid in Congressman Fine's district, we asked them what they were doing to help end the stalemate.
Well, I did what we could do to reopen the government. On September 22nd, we voted for a continuing resolution to keep the government open. If Democrats in the Senate would just vote for it, the government would reopen. So we are waiting for 5 Democratic senators who will put the priorities of Americans over the priorities of illegal immigrants and get the government open.
Congressman, it doesn't seem like they're going to agree to what was passed in the House. Should the House come up with another bill to then send over to the Senate?
What would we come up with? The bill was 24 pages. All it does is extend current spending levels, as no policy riders. There's nothing to actually take out of the bill.
I've been going up every week. We are there. We're ready to speak with our Republican colleagues. But here's the problem. Republican Speaker of the House, Mike Johnson, said in writing, the House is not coming back until the government reopens. And my question for him is, if half of Congress doesn't come to work, how will the government reopen? How will the government reopen when the elected representatives of the people are not doing their job? And so I've been in D.C. every single week with Democrats from across the country saying, come back, let's fix this healthcare crisis so healthcare doesn't go up upwards of 300% for about 200,000 people in my district alone. Let's pass a bill and reopen the government.
Healthcare is the sticking point in the standoff.
I think we have to take a look at the Unaffordable Care Act. I challenge the premise that throwing trillions of dollars at something that we were told was affordable is a fix. We can continue to do this. We can continue to bankrupt the country, or we can figure out how to fix health care. And that's not something you can do when the government is shut down.
Democrats want to extend the ACA subsidies that expire this year and to roll back the president's Medicaid cuts. Republicans say they don't want American taxpayers to pay for the health care of undocumented immigrants. Undocumented immigrants aren't eligible for coverage under federal guidelines, but according to the Congressional Budget Office, federal and state taxpayers paid more than $16.2 billion for the first 3 years of the Biden-Harris administration to provide Medicaid-funded emergency services to undocumented immigrants. We asked Congressman Frost if it was disingenuous to say undocumented immigrants didn't have some of their health care covered.
I want everyone watching to think about this. There's an undocumented person who's having a healthcare crisis. Let's say a child, for instance. They're having a crisis. They don't have health insurance or anything. The ambulance has been called and they have been rolled into the emergency room. They are dying. They will die if they do not receive help within a matter of minutes. You choose what country you want to live in. Is it a country where first we ask them, what's your documentation? And then we help them afterwards, perhaps, maybe, or we don't help them? Or is it a country where if a human rolls through the doors of an emergency room, we help them? You make the choice in what country you want to live in. If you really want to debate the merits of what is a very, very, very small percentage of money that ensures not just for people of different statuses, but that every American that's rolled into an emergency room doesn't have to worry if they're on the brink of death to get stabilized, that's, a decision you can make. For me, I want every human that goes into an emergency room that's about to die to get stabilized. And by the way, that's what that is. They don't get health care. They don't get a whole treatment plan. They get stabilized. That is what that pot of money is about.
I would note in those numbers, when an illegal immigrant goes to the hospital under the Democrats' plan gets more money than when an American goes to the hospital. The only money I'm interested in spending on illegal immigrants is to buy them an airplane ticket to go home. None of them should be here. We shouldn't be spending a nickel on illegal immigrants going to our emergency rooms.
We also pressed Congressman Fine on health care and Republicans' argument not to bring up the topic before opening the government and whether the move is in the best interest of his constituents.
You do not hold hostages in order to try to get policy passed. You reopen the government and then you have a debate in the light of day. It is a debate that I am looking forward to have. But I'm tired for the Democrats' lies to say you can only talk about the Affordable Care Act, or as what I should call the Unaffordable Care Act, if the government is closed.
And Congressman, Democrats have argued that Republicans cut $2 trillion in tax cuts to the top 1%. That money could have been used to cover these ACA subsidies. Which one is the most important thing that's going down the road, and how do you justify the tax cut when you're cutting subsidies for people at home?
Well, look, when Democrats are talking, they're lying. It's not true. I am one of those people who supposedly got a tax cut, but I'm going to pay the same tax rate next year that I paid this year and the year before and the year before that. We did not create any new tax cuts for the wealthy. But I would note in their plan, in their hostage plan, where they say you have to spend $1.5 trillion on illegal immigrants, they are not proposing anything to pay for that.
We asked both congressmen what this would mean to the hundreds of thousands of Central Floridians in their districts who would lose ACA and see their premiums increase.
Well, I think these are complicated issues that require the government to be open to think through. I think the Democrats need to have a clear statement that the Affordable Care Act is not affordable.
It completely can change your life. In fact, we've been asking people to send in letters, to send in notes, to let us know if they've already gotten that letter. I've had phone conversations with many constituents who have already gotten it. So when Donald Trump and Mike Johnson say, let's handle this later, that's unacceptable. I've spoken with someone who received a letter that said, your health care is going up double. And what people are doing is, working people have to make decisions now based on what they know will happen in the future. If you receive a letter that tells you, hey, next year you're paying double for your health insurance, it means you're gonna cut corners and probably pay less at the grocery store for things. You're gonna get less groceries for your family, less food on the table. It means perhaps you're gonna have to rethink where you're currently living. You might have to move somewhere else because the rent is also too damn high. You're also gonna have to think about all the daily goods that you buy to keep your family afloat because of these damn tariffs that Donald Trump has imposed on us. All the prices have gone up from A to Z. And so this is a huge deal for working families. And you know what? It makes sense why most of this country hates Congress. Because what other job can you say, no, I don't want to do my work right now. Let's clock in at the end of the year. I mean, that's essentially what Donald Trump and Mike Johnson are saying, is let's clock in at the end of the year on behalf of our constituents. That's horrible. It's unacceptable. Call Congress back now. Let's pass the bill. Let's save healthcare, and let's move beyond this.
Well, I think the Republicans are working on a lot of issues related to health care behind the scenes, but Americans should not be paid because Democrats want to give health care to illegal immigrants.
We asked Frost about what it will take to end the shutdown, bringing up President Trump's comments saying he was open to talking about health care.
The president has hinted that he is open to talking about health care with Democrats. What's it going to take?
Well, it's cool to say you're open to talking with people about healthcare. How about actually talking with people about healthcare? When he had the meeting with Democrats in the White House, what did he do right after? He posted a racist AI meme of Democratic leaders. He didn't respond to them and say, let's talk about it. He didn't even respond and say, here's my idea on how we can handle this. So when Donald Trump comes up and says, I'm open to talking about folks, bro, you're the president of the United States. Call a meeting and let's actually do it. We have been in D.C. every single week. So what is it going to take? Mike Johnson needs to call the House back. Again, he has said that the House of Representatives will not go to work until the government opens. But the question is, how will the government open if we don't go to work?
We pushed the question again.
We did ask, what will it take to end this standoff with the government shutdown? And you said it would take calling the House back to work. But you yourself said Johnson does not seem interested in doing that. So if he doesn't do that and Democrats aren't backing down, I ask again, what will it take to end this?
It'll take people going back to work. It'll take doing the job that we were elected to do. Republicans run the federal government. Remember, they run the House of Representatives. They have the most votes there. They have the most votes in the Senate, and they have the presidency. They could, if they wanted to, pass this. They don't need Democratic votes to pass it. But here's the thing. They don't even want us to go to work. So how do we get through the government shutdown? Politicians need to show up to do their damn job. That's how we get through the government shutdown.
Congressman Randy Fine commented on what's holding the Republicans back from moving forward.
To pass most things in the Senate requires 60 votes. We do not have 60 votes. Therefore, we do not control the Senate. We control aspects of the Senate, but not all of the Senate. And rules changes are a decision that the Senate has to make. But the challenge is when you change the rules, that they can come right back on you next time. And so I think there is we're actually looking forward to the future of the country when there's a time when we may not be in charge. And do we want Democrats to be able to run roughshod over us? That's a decision for the Senate to make. But I again would challenge the premise that we are in charge of the Senate. We are not in all cases.
Let me ask you this. If Democrats do not back down and you don't get those 5 Democrats to change their votes, how do we get the government back up and running?
I mean, then Democrats apparently are going to keep the government closed forever. I think what you'll see is President Trump continue to do the kinds of creative things he's doing. And I guess we'll keep letting federal workers go to be able to fund the government. But again, Republicans have voted 11 times to reopen the government. Democrats have voted 11 times to keep the government closed.
All right, if the shutdown lasts into next week, SNAP and WIC benefits will be at risk if additional short-term funding is not approved. You can expect longer airport delays as air traffic controllers and TSA workers become increasingly stressed. And if the shutdown continues another week, expect far more stress on systems and more delays across the government. That includes more missed federal paychecks and military families missing housing and childcare stipends and subsidies.
WESH 2 is helping you get the facts on government shutdowns. Head to WESH.com to learn how often they happen and how long shutdowns have lasted in the past.